issues. What are they? And what the heck is a pelvic floor therapist? In this episode, this is one of 3 that we are going to address pelvic floor issues. Issues that plague all of us. Peeing when we cough, painful sex, incontinence, whatever it might be for you. These issues keep us from being as active as we want to be, and we deserve to be. But before we can ever address any of those issues, we really need to get clear on what pelvic floor issues are. What is the pelvic floor? And what is and who is a pelvic floor therapist? You may be surprised, ladies, that it's not all about Kegels. So here's the deal. We have Brooke GREENE. We've invited her to share exactly what she knows about the pelvic floor, because guess what? Brooke GREENE is a pelvic floor therapist from Dresher Physical Therapy, and she is in the nest with me to help demystify what pelvic floor therapists do and let us know exactly when we might need one. So welcome, Brooke. It's so good to have you here. I wish we could be sitting side by side, but you know, Zoom is making this happen. So I know I just introduced who you are, but if you take a minute, just share with everybody who you are and what you do, what as a therapist we can expect when we go visit one.
Well, first of all, thanks for having me. This is certainly an under-discussed topic and keeps me busy all week long. Yeah. So pelvic floor therapist, we are a normal physical therapist by trade, the ones you think of out in the gym, rehabbing shoulders, necks, back, knees, you name it. That is our foundational training. But when you go on to become a pelvic floor therapist, you learn how to specialize in it. You learn the things you don't learn in PT school, and you take extensive coursework because it is such an intimate, personal part of our body, and there's a lot of things going on there. So I actually have my little model here with me today. So here's our pelvis, our backbone, our hip bones, our pubic bone, and then sitting in the bottom of our pelvis is our pelvic floor. So we all have one. It supports all of our pelvic organs. It relaxes to let us go to the bathroom, whether it's bladder or bowel, and then it has sexual function. So when you come in, what can you expect? You can expect me to ask you every question under the sun about all of those things. It's super nitty gritty, but it helps me help you better. And then, you know, we look you over head to toe. It's not like we have tunnel vision to the pelvis, but you'd have your normal screen. Like if you've had physical therapy before, I look at the strength and range of motion in your core and your hips, because as you can see, there's your hip socket here and your back. It's all very closely linked. But where I'm a little bit different is I'll do a pelvic exam if you're comfortable with it, but it's not like the gynecologist. There's no speculum or stirrups, but we are trained in assessing muscles and figuring out what might be going on with yours. So signs and symptoms that you might have something going on with your pelvic floor that could warrant you coming in to see me are leakage, whether it's bowel, bladder, you have pelvic organ prolapse, your bladder's dropped a little bit. Sometimes people don't even know that's a thing.
That's what prolapse is, when your bladder drops.
Yes, any of those parts, bladder, uterus, rectum, anything can drop, but nobody tells us about it.
They can all drop. That sounds terrible. Okay.
I know. I usually, like, people come in and they're like, I saw something there and I went to the ER because I didn't know what it was. And then, you know, if we just talked about these things more, we might know.
Yeah.
So that, and we do the pelvic exam, we figure out what's going on with the pelvic floor. But what might warrant that, as we were saying, is incontinence of any kind, constipation, tailbone pain, maybe you have low back pain that hasn't responded to the traditional types of physical therapy, the painful sex, you know, abdominal pain, any post-surgical pain, hysterectomy, I mean, you name it. Urgency, frequency, the list, I could go on and on for days.
So it sounds to me, I mean, and you hit a nerve with the lower back pain. If you have lower back pain and you've been going and seeing people and you can't get to the root of it, seeing somebody like you who has a specialty in the pelvic floor versus running right to a surgeon, I mean, there's always a time. I mean, obviously, everybody listen, consult your professional, consult your primary doctors, consult your specialists. But to me, that just said to me, okay, there's somebody else to see prior to jumping to a surgery possible option.
Absolutely. You want to exhaust all of your conservative resources. You know, with anything, there comes a risk. And I say in the general scheme, like having a consultation with a pelvic floor physical therapist is a very conservative option. And at least you know you've exhausted all of your resources, or even before you decide to go down the rabbit hole of different medications for bladder issues and things like that.
No, that's smart. That's smart. It's funny going back to what you said about prolapse. I think the only thing I ever heard that could drop is your bladder, because when you get pregnant and you go through pregnancy, a lot can happen with your bladder. Oh my God, that's a whole nother topic. But so I think what most of us think about most when it comes to pelvic floor is the leakage part. And we're going to do a whole thing on incontinence, so we'll get to that. And that's a whole episode on its own. But the number one exercise that all women are told to do by our OBGYNs, by even other professionals, but mainly from our OBs, is Kegels. That if you do these exercises, contract and whatever, I don't even know how to say it, that you can strengthen the muscles of your bladder and prevent, leakage from happening. So what I learned from you, and I would love for you to share, is like that there are times when Kegels aren't effective, and there are times you should do them, you shouldn't do them. And this is a good use of the word should. So, what are symptoms that you feel would be appropriate to recommend to a patient to do Kegels, and then when might it not be?
Yeah, so typically you want to strengthen if you're having leakage. Normally it's a sign the pelvic floor muscle is weak, or prolapse. Definitely get those muscles stronger so you're supporting your pelvic organs better and around the urethra, keeping that leakage from coming out. Sometimes people don't talk about it either, but incontinence with gas. A lot of people are embarrassed about that. They're walking around and they don't know what's coming out, and then they're mortified. So those muscles surround that area too. So that's typically an indication for that. Those are the main ones where strengthening is indicated. And then where it's not is typically maybe you have a too tense muscle already, right? So that can happen too, even in the pelvic floor. So that might be your pain with intercourse, your tailbone pain, your constipation, your low back pain, who knows, any number of those things. But that's where our evaluation comes into play to just make sure we know on the spectrum where it falls. But generally speaking, those are times where you wouldn't want to strengthen.
Right. Okay. We get that. We also, you and I also talked about something I'm remembering, that, and we're not dissing OBGYNs. I love my OB. He's an awesome human being. He's an amazing doctor. But you did point out that sometimes OBGYNs might not be sharing and not focus on the prevention when it comes to Kegels. What did you mean by Kegel? I'm saying Kegel.
Kegel, tomato. It's one of those. But yeah, absolutely. So, it's never too late to see a pelvic floor therapist if you've been suffering with any of those symptoms for years or days. What it comes down to is that we can proactively see a pelvic floor physical therapist, even if we're not really having too many issues, or you think, oh, it's mild, I don't need to worry about it yet. You want to think down the line and down the road, and whether you've had children or not, it doesn't really matter. But in Europe and a lot of countries over there, women automatically get a referral to pelvic floor physical therapy postpartum. And we should all have that at some point in our life, so we know what our pelvic floor is, how to prevent these things from happening, because maybe if you strengthen more in your earlier years, you're less inclined to develop that prolapse later in life when those muscles have weakened and you've lost some of that elasticity and things like that.
Okay. No, this was helpful, because you know what, we think we know everything that's involved with pelvic floor, but I mean, you've shared quite a lot. So I would say the big takeaway, and I'll let you say it, when somebody should say to themselves, you know what, these 3 things or these 4 things have been happening. One of these 4 things is happening, and this is when you would see a pelvic floor therapist. What are, name your top symptoms? I know we already talked about them, but let's just summarize the top symptoms if you're experiencing X, Y, Z, and Q and G.
Yeah, so if you've had all your work up to, but any kind of pelvic pain, be it with intercourse, abdominal pain, post-surgical pain, it's one of the main diagnoses I see, but you want to make sure it's not for any other reason. Always, like you said, consult your medical provider. That's super important, but it's one of the main things I treat. Any type of incontinence, whether it's urine or stool, don't be embarrassed. It's not uncommon. I deal with it all day long. So there's a lot of people out there suffering in silence, and you don't need to. And urinary frequency, just in the bathroom every 20 minutes, or just feeling like you have to go all the time, and you're going on a road trip and you're stopping every 20 minutes to use the restroom. Those are some of the biggest ones I would say I treat. And then of course, during pregnancy itself, I see pregnant patients, and it doesn't have to be, oh, you're growing a human. It's going to hurt. Your back's going to hurt. Don't take that for an answer either. If any of your children, daughter-in-laws, whoever are dealing with that too.
No, I appreciate that. Great tips, great advice. Now we know that a pelvic floor therapist exists. There you are, live in person on my computer screen. Um, and Brooke does work currently at Dresher Physical Therapy, and you have 2 locations of Dresher Physical Therapy in Fort Washington and in
Yes.
Bluebell, correct?
Yes.
And I
Yep.
know this because, I guess, fortunately, because I found them, but unfortunately that I had to find them. I'm a big tennis player, so I get the knee pain and back pain, and we're going to be talking to another expert from Dresher Physical Therapy all about that. That has nothing to do with the pelvic floor. But I will post um, where people can find you and how they can reach out to you. And I really thank you for this. And like I said, this is just one of 3 conversations Brooke and I are going to be having on pelvic floor issues. The next 2, I think we're going to be talking about painful sex and incontinence. And I'm excited to really open up the discussion on this, because like you said, I think there's a lot of women silently and men silently and staying in a state of embarrassment, and more people than we know are all suffering from these issues. So thank you, Brooke.
Thanks for having me.
Yeah, thank you. If you want to connect with me, because I would love to connect with you, please head over to jodisilverman.com. Everything about In the Nest is there. Everything about our community Moms Who Dare is there. And everything about me is there. There's also opportunities for other experts and other moms to be in the nest with Jodi. You can sit right where Brooke is on the other side of the computer screen. If you have a topic you'd like to hear shared, or if you would like to be a guest on the show, head over to jodisilverman.com and reach out to me. And as I always say, dare on.